Pharmacist is brought to you by Dragnet, your number one online pharmacy, and the Pharmaceutical Society of Ghana, and proudly sponsored by Lita Pharmaceuticals, quality healthcare, with support from Vitsifort, your best vitamin C plus zinc supplement from Samus Pharma.
Hello everybody, you are welcome to another week of Ask Your Pharmacist. Of course, this remains the only health show that brings all you need about that medical condition, the diseases, the medication, even drugs to your doorsteps. So I hope that by the end of today's discussion, you will love to stay healthy and be healthy forever. Remember that my name is Peggy Sano, and you can find me on Instagram at FieryPeggy. And if you missed any of our episodes, go on YouTube right now at My Pharmacist TV. Like, share, comment, and make sure you subscribe. This show is proudly brought to you by Dragnet, your number one online pharmacy. Download the Dragnet app on the Google Play Store, the App Store. Order all your medications, speak to a pharmacist, and wherever you are, Dragnet will deliver to you. Dragnet is your number one online pharmacy. This is also brought to you by the Pharmaceutical Society of Ghana. Amicus Humani Generis Pharmacists are indeed friends of the human race. This is also brought to you by Lethal Pharmaceuticals. Letamin is a multivitamin mineral supplement for total strength and vitality, promotes mental performance, and boosts the immune system. Folaron Zinc is a folic acid, iron, and zinc supplement that effectively reduces the risk of iron deficiency, supports immunity, and promotes health and wellness. Letamox is a single-dose dewormer for treating intestinal worm infections and helps to increase nutritional uptake. Letamin, Folaron Zinc, and Letamox are all available in any pharmacy near you. For bulk purchases, contact Lethal Pharmaceuticals on 030-222-4613. Lethal Pharmaceuticals, quality healthcare. This is also brought to you by Bell Beverages. Bell Beverages, refreshing the nation. And also brought to you by Tema Christian Eye Center. Tema Christian Eye Center remains the best and advanced eye care facility with ultra-modern services, skilled and experienced doctors, and their customer service, top-notch. Please contact them on 030-321-1999 or locate them at Tema Community 1 adjacent the St. Paul Methodist Church. The show is also supported by Vitsifort. Vitsifort is a sugar-free vitamin C plus zinc supplement from Samus Pharma. For bulk purchases, contact Samus Pharma on 0501-646494. This is also supported by the Lady Pharmacist Association of Ghana, LEPAC, and the Young Pharmacist Group. We are taking a quick break. The show continues. Do not go anywhere.
When on campus and not well, I worry no more. Thanks to Dragnet. With the Dragnet app, I can chat with a pharmacist anytime for my medications, and they are delivered to me right here on campus.
I am a trader. If I need drugs, I cannot leave my goods and visit the pharmacy. All I need to do is click on the call feature on the Dragnet app and I speak with the pharmacist. The drugs are delivered to me right here. Dragnet, ahotoswo papa.
As a businessman, moving around to search for my medication could be very frustrating. But now, with the Dragnet app, I'm able to upload all my prescriptions and have them delivered to me wherever I am. The Dragnet app also allows me to order refills for my mother to treat her chronic illness. Dragnet delivers all the medications to her on time. It's so reliable and convenient. Download the Dragnet app from the Google Play Store or App Store. Dragnet, your number one online pharmacy.
Welcome back. You are watching Ask Your Pharmacist, your favorite health show. So today we are celebrating World Hepatitis Day, and we are celebrating it from the College of Physicians and Surgeons here in the Greater Accra region of Ghana. If you're wondering what hepatitis is, do not wonder no more. Go on YouTube right now at My Pharmacist TV. We've had so many discussions and deliberation on hepatitis, and I know that you will learn so much from it, so do that right now. But we have so many specialists and medical practitioners who have been treating hepatitis and have so much knowledge in what hepatitis is, and I hope that you will grab a thing or two from today's discussion. So like the theme says, we are bringing hepatitis care closer to you. And I have with me Pharm Stephen Kokwe. He is a senior specialist clinical pharmacist and a fellow at the Ghana College of Pharmacists and also a member of the Hepatitis Society of Ghana. How are you doing today, Pharm?
I'm fine, and how are you too?
I'm doing very well. I mean, I would like to also get your thoughts on today's celebration. What can we do to make it better, and your general thoughts on bringing awareness to the doorstep of Ghanaians?
I think bringing awareness, we've come a long way, and the Pharmaceutical Society of Ghana started the awareness program as far back as 2005. So we have come a long way, and we are happy that other stakeholders have joined.
Wait, were we the first though?
We were the first. And we were then doing the screening and the testing and getting, so we have a lot of data as far back as 2005. But what we are happy is that other stakeholders, the Hepatitis Society of Ghana was formed, the Hepatitis Alliance was formed, the Hepatitis Coalition was formed, and all the other people who are engaged in hepatitis management. And we are happy that today we met and to look at the WHO program of eliminating hepatitis in 2030. And I'm happy that some of the things that strategies that we are put in place. We are going to look at the treatment, we are going to look at testing, we are going to look at how people can be more aware. And if you look at the theme for today, we are saying that hepatitis care should be closer to the communities. And so for me, this year we were closer to a community like La. So yesterday we did the screening and the testing, and we created awareness of the people. And that's what should be done. If you want to eliminate hepatitis by 2030, people in even the remote area of Ghana should know about the disease. Because the prevalence is high, especially in the north, where you don't have any of the activities being done. And so we need to make sure that we strategize. And with government supporting and all the stakeholders also giving their best, I think we'll get to where we are.
I love the sound of that. We will surely get closer and closer to everybody. From what are your final words to our viewers?
So my final word is that from today, we have celebrated the Hepatitis Day. The awareness is that hepatitis B is a killer. Hepatitis C is a killer. It kills slowly within 20 years. So you might not know that you have the disease unless you test. So we are encouraging everybody to test. And if there's the need for you to be vaccinated, we'll find a way to vaccinate. If there's a need to treat you, then to treat you. But the young ones are the people who are getting cancer of the liver. And so if you are able to get them early and treat them early, we will not be able to get there. I just believe that the media too has a role to play. And so constantly, not only today, every month, keep on hammering on hepatitis elimination, and we'll be glad with you people. Thank you so much.
Thank you so much, Fa. So I'm here with Dr. Ajua and Doug. I would like to, understand the need for us to celebrate or understand why we should promote this cause.
Okay, this 28th July has been earmarked to create awareness as to how we can eliminate hepatitis B and C as a global health threat by 2030. And this is being celebrated all over the world. The day was chosen because the person who discovered the virus was born on that day. So it's an honor to him. So during World Hepatitis Day, we come up with WHO comes up with different themes that we use. And this time it's saying that we should take hepatitis prevention to the communities because hepatitis cannot wait. So we're doing this to create awareness, to let people understand what hepatitis is, how it is transmitted, and if you have it, what you have to do, and those who don't have it, what they should do to protect themselves.
Okay, so very briefly, what are the types of hepatitis, just so our viewers could understand?
So when it comes to hepatitis, there are 5 different types: A, B, C, D, and E. A and E, that is the beginning and the end, they are contaminated food. Usually when you get it, maximum a month, the body clears it. So our main emphasis is on B, C, and D. That has a potential of living with you for the rest of your life, leading to the cirrhosis as a complication and liver cancer as another complication.
Okay, so how prevalent is it in this part of, the continent? I know in Ghana we like to say, oh, yarebi wo honuma yemro for yare. How serious is this?
It is. Now, when you take the prevalence of hepatitis, based on studies that have been done, it's about 12.3%. Now, we also looked at hospital data and registry, and up there, Upper West, it was somewhere around very high, around 17 or 18%. So on the average, you say every 100 people you pick, at least 12 of them have hepatitis B, compared to HIV, which is less than 2%.
What are some of the challenges you encounter being on this field? I mean, I know you've been doing this for so long. What are some of the challenges you've encountered so far?
No, the challenges, we've done lots of education, but are we seeing the impact? I must say that yes, but it's very minimal. We do the education, we know what is right. WHO has given us tools if we have to eliminate the vaccination, looking for people with the disease and treating them, investigating and treating them. But now, the thing is that if they are picked up, they have to bear the cost. Even going to pick them, people don't even know what it is. Education is very low and it's so much stigmatized. Those who have it are also hiding because they will be stigmatized. There's lots of discrimination. Some people during pre-employment will not employ people with hepatitis B, thinking that they are going to infect. I don't know the reason why. And even sometimes when people are traveling outside, especially to the Arab Emirates, they screen them if you have hepatitis B. They tell you that wait until you are cured before you come. And the disease is not curable. So it is a problem.
Okay. All right. So what are your final words to our viewers?
My final words is that we should all know our status, whether we are positive or negative. If you are negative, you can go for the vaccine. If you are tested positive, please seek care. And for those who have tested positive, don't give up. Still continue to seek care because sometimes you are not sure when the complications will arise. And it's always better to prevent the complications than wait until it comes for you to cure it.
Alrighty, thank you so much. I'm more than happy to have you today. Thank you. All right, so Doc, how often do you tend to see cases with hepatitis B in your consulting rooms or the hospitals?
Okay, so when it comes to hepatitis B, then in our clinics, which is the gastro clinic, about 3/4 of the patients we see are hepatitis B patients. Some come in with complications, some come in routine screening, they are positive and they report to clinics. But about 3/4 of our patients are hepatitis B positive.
Alrighty, then let's talk about the chronic hepatitis, which I hear is the most deadliest. What's your take on people trying to, treat it at home and they end up bringing it at the latter state in the hospitals?
Okay, so when it comes to hepatitis B, that's a chronic type, I won't advocate for anybody to treat it at home because you never know the level of your viral load. So what we know is that the higher the virus, the higher the chance of getting a complication. So it's better to report to the hospital, get the right testing done, know the levels, know whether you have to be on treatment or monitoring. And then even if you're on monitoring, you may be on monitoring today, the next time the viral load may go up, and then we may have to put you on medication. So it's better to come to the hospital, know the processes, then the right timing, when medication, if medication is needed or not, then we can start you. So home management is not the best.
So just to get it right, it's possible that you might be infected today, but with the right treatment, you can get back on your feet and be normal.
So if we talk about chronic hepatitis B, then I'll rank it like somebody with hypertension or diabetes. As it's not everybody who is on medication. It depends. So it depends on your viral load and then the effect it's having on your liver. So we can advise that you should be monitored for some time. Some people need to be on medication. If you're on medication, it keeps the viral load down. and then you live your normal life to prevent the complications. What is dangerous is when the complications develop, and that is when it's difficult to go back to your normal state. But then once you are being monitored and you are within the normal rate, that can be always taken care of in the hospital.
Alrighty, so what's your final words to our viewers?
Get tested, get vaccinated, or come to clinic if you are positive, and then let's save a life.
Alrighty, let's save a life. Thank you so much, Doc.
When on campus and not well, I worry no more. Thanks to Dragnet. With the Dragnet app, I can chat with a pharmacist anytime for my medications, and they are delivered to me right here on campus.
I am a trader. If I need drugs, I cannot leave my goods and visit the pharmacy. All I need to do is click on the call feature on the Dragnet app and I speak with the pharmacist. The drugs are delivered to me right here. Dragnet, ahotoswo papa.
As a businessman, moving around to search for my medication could be very frustrating. But now, with the Dragnet app, I'm able to upload all my prescriptions and have them delivered to me wherever I am. The Dragnet app also allows me to order refills for my mother to treat her chronic illness. Dragnet delivers all the medications to her on time. It's so reliable and convenient. Download the Dragnet app from the Google Play Store or App Store. Dragnet, your #1 online pharmacy.
Alrighty, so it's World Hepatitis Day celebration, and I just want to ask you a quick question. What is the relevance of knowing your hepatitis status?
Well, hepatitis, as we know now, has become a very common thing, like HIV, like syphilis. It's also rampantly developing, so it's important for you to know so that you can prevent the complications. Hepatitis can progress to become cirrhosis, and then you go to hepatocellular carcinoma. And when you get to that stage, really, there's nothing much that can be done. Yeah. So if you know early, then you can prevent it. You can get early treatment. Be educated about it, literally, and then for hepatocellular carcinoma as well, you know, when you get to that stage, there's nothing to be done, and then the last resort will be getting a liver transplant. So that's literally not done here in Ghana. So the earlier the better. I mean, you know it, then you prevent it, and then that's it.
Okay, the earlier the better. We're still on the World Hepatitis Day celebration, and I'm here with Jemima from Technology Advantage Group. How are you doing, Jemima?
I'm very well. How are you too?
I'm doing very good. I've seen a lot of seminars going on, a lot of education on hepatitis. What have you learned so far?
It's been an eye-opener today because I've actually learned a lot. I didn't know how scary hepatitis is until this morning or today. But one key thing I have surprisingly chanced on hearing through the panel discussion is how the media is also doing their part in terms of educating the public, because per the data that they gathered, those in the Upper East, the Northern, those up there have the higher records in terms of data. So I'm urging the journalists, the media, to also lay emphasis on health. I think we claim we pay attention to health, but from what we are learning today, much education is not given on health in that side. So this is for the journalists.
Alrighty, I agree with that. We can definitely do much better. That is why Ask Your Pharmacist is here to always provide you with the right needed education on your health condition. So I agree, maybe we should pay a visit to the Upper East or Upper West to bring the education to their doorstep. We'll definitely do that. There is so much learning and studying here at the Ghana College of Physicians and Surgeons, and we are still celebrating World Hepatitis Day. And I have with me, what's your name?
Austin.
Okay.
There is some.
Stephen Kwame Usu.
Alrighty, I could see you have your pens and your book, and I would love to start with you. What did you learn from today?
Well, I learned that today is the Hepatitis D Day, and I learned that there are a lot of causes and there's a lot of unawareness of the people in the community and also in the nation, which is also causing more infections to the people.
I definitely believe that. What about you? What did you learn?
I learned about the transmission of hepatitis. I learned that it can be transferred from child to child and also from mother to child. And the rate at which mother to child transmission are increasing. And I learned that they are bringing a vaccine for the treatment of mother to child.
That's very impressive. What about you, gentleman?
I learned a lot. I also saw some rates or figures of how increasing hepatitis B is becoming in our part of continent, that's Africa. Um, Actually, hepatitis B, unfortunately, is affecting our youth or productive ages, and it's very unfortunate that it's not made very aware in our parts of world, and so we encourage that hepatitis B should be made aware in Ghana and the whole of West Africa and Africa as a whole, especially looking at the rate in the northern region. It should be made more aware there, and people should start getting tested for it and then going for treatment as well.
Absolutely. What would you say to your some of the students watching you today? How should they prevent? Why should they get tested? What kind of message would you give them?
I want to tell them that hepatitis is not from rich crabs or kids. So when their parents are advising them that they should see a pastor, they should tell their parent that they should have to see the doctor in case, so that they can treat them early, so that they won't reach a rate of yeah.
Like you heard from her, get tested today. And if you have it, the first point of call should be the hospital, not anywhere else. Thank you so much, Accra High. And I hope you enjoyed today's discussion. So finally, I have with me a custodian of drag here. And I have Pharmacist Abe Ashon. He's the product manager and pharmacy superintendent at Mega Life Sciences. Farm, how are you doing today?
I'm doing great, doing great.
Well, glad to see you. So being a custodian of drag, I mean, you've been in this field for a very long time. What is the best and effectual approach to managing or even treating hepatitis or even liver cancers and infections?
Great. Thank you so much for your wonderful question, and thank you for having me on your August platform. When it comes to the management of viral hepatitis, it's actually multifaceted because there are different forms of viral hepatitis. In fact, broadly, hepatitis is considered as two forms. That's acute hepatitis B and chronic hepatitis B. Usually, if you are diagnosed of having viral hepatitis B, if it lasts within 6 months and then it goes out of your system, then you are determined, or they say that you have viral hepatitis B, acute version. But the chronic version is when the virus stays in the system for beyond 6 months, and that affects treatment. Okay, so usually when it comes to chronic viral hepatitis B, you may want to put the patient on antiretrovirals to take care of reducing the viral load, which is very important. And when it happens like that, then you have to put the patient on medications like tenofovir, which is an antiretroviral medication. However, sometimes you may also have to take care of the integrity of the liver, because the virus, probably once it's installed in the liver, causes a lot of damage to the liver cells. You understand? When it happens like that, there's a need to add a supporting therapy. This is where hepatoprotectants come in. Hepatoprotectants like Livolin-4, which are 3-in-1 hepatoprotectants, usually help with the rapid structural recovery and improving the function of the liver cells. It's very important to note that even beyond that, there are other non-pharmacotherapeutic interventions that could also help. It's very important to note that certain activities of humans, like excessive alcohol consumption, eating a lot of deep fried foods, sandwiches, sausages, and all that, puts a lot of pressure on the liver. The reason is that the liver is one of the main organs that break down harmful substances from the body. And everything that you take, there's something referred to as first pass effect when it comes to pharmacy. First pass effect means that any medication you take, any food you take, it goes through the liver first. And because of that, most of the excess free radicals that are generated by a lot of harmful substances we consume actually destroy the integrity of the liver, and they produce a lot of free radicals that attack the integrity of the liver cells. And that's the reason why sometimes you need very powerful antioxidants that are in hepatoprotectants like Livolin-4, will help to protect the liver against the harmful effects of these free radicals. But even beyond that, apart from all these things, there are a lot of things you could do. Green tea, for instance, has very beneficial effects for the liver. Garlic, for instance, even avocado, nuts, olive oil, they play a very important role in helping protect the integrity of the liver. Yes.
You're not too fatty for the liver?
No, No, not at all. In fact, research suggests that these substances that we have in abundance could help protect the integrity of the liver because they have very good antioxidant properties also. So beyond the antiretrovirals, you may want to look at hepatoprotectants like liver-lymphoid, and you can also look at adjusting your lifestyle, exercise, diet, and like I said, green tea, other things are very beneficial for the liver.
Thank you so much, Fam. That was super helpful, and I hope you caught a thing or two from that. Thank you. Dose for Healthy Living is up next. Don't go anywhere.
Today on Dose for Healthy Living, ask your pharmacist. Don't hesitate to ask your pharmacist questions. If you have concerns about your medications, remember your pharmacist is your friend and an important resource for all medication-related questions and concerns.
So this is where we end today's celebration on World Hepatitis Day. I hope you learned a lot from the discussions we had with the experts. Remember that this show, Ask Your Pharmacist, was brought to you by Dragnet, your #1 online pharmacy. Download the Dragnet app on the Google Play Store, the App Store, order all your medications. If you have hepatitis or any kind of liver infection, do not worry. Speak to the specialist on the Dragnet app. They will deliver your supplements or medications to you. Dragnet is your #1 online pharmacy. This was also brought to you by the Pharmaceutical Society of Ghana. Amicus Humani Generis, pharmacists are indeed friends of the human race. This was also brought to you by Letta Pharmaceuticals. Lettamin is a multivitamin mineral supplement for total strength and vitality, promotes mental performance, and boosts the immune system. Foliron Zinc is a folic acid, iron, and zinc supplement that effectively reduces the risk of iron deficiency, supports immunity, and promotes health and wellness. Letamox is a single-dose dewormer for treating intestinal worm infection and helps to increase nutritional uptake. These are all good for the family. So Letamin, Folironzing, and Letamox are available any pharmacy near you, or contact Letta Pharmaceuticals on 030-222-4613. Letta Pharmaceuticals, quality healthcare. This was also brought to you by Bell Beverages. Bell Beverages, refreshing the nation, and also brought to you by Thelma Christian Eye Center. Thelma Christian Eye Center is the best and advanced eye care facility with ultra-modern surfaces, skilled and experienced doctors, and their customer service remains the best in the nation. Into so when you are another patient, another be for when you are, or you said you are another operation Pampacho Thelma Christian Eye Center. They are located at Thelma Community 1, adjacent to St. Paul Methodist Church. Another throw one, it was 030-3211-999. This show was supported by the Lady Pharmacist Association of Ghana, LAPAC, and the Young Pharmacist Group, and also supported by Vitsi Fort. It's a sugar-free vitamin C plus zinc supplement from Samus Pharma. Contact Samus Pharma for bulk purchases on 0501-646494. Like I always say, whatever that goes in you is merely irreversible. Always ask your pharmacist before you swallow that pill. My name is Peggy Sanwell. You can find me on Instagram at FieryPeggy and update yourself with any of our videos on YouTube at My Pharmacist TV. I'll be coming your way same time next week. Until then, be safe, and it's bye-bye for now.
Ask Your Pharmacist was brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, and proudly sponsored by Lita Pharmaceuticals. Lita Pharmaceuticals, quality healthcare, with support from Vitsi Fort, your best vitamin C plus zinc supplement from Samus Pharma.